Federal funding in the fight against COVID-19 is running low, according to lawmakers, and now some doctors are worried the burden cost may fall on the uninsured. WCNC Charlotte's Brianna Harper explains what the next steps are and the impact it may have on this ongoing pandemic.
For the past 2 years, StarMed has served thousands of patients absolutely cost-free during this pandemic, and that includes those with and without insurance. But we're told if Congress doesn't act fast, that could all change.
Running out of time and running out of money. As the U.S. anticipates a possible new wave of COVID-19 infections, the White House is urging immediate action.
Senior administration officials have held more than 36 calls and meetings with Congress and at least 10 briefings to committees to communicate our needs so that we can do what Americans should expect from their government, protecting them from a once-in-a-generation pandemic.
White House leaders now asking Congress for an additional $22.5 billion to continue to fund COVID testing, treatment, and vaccine. But if not, we're told the cost will hang heavy on those without health insurance.
People who are uninsured, who are highest risk patients, who are highest risk of unfortunately having bad outcomes, are going to have to pay out of pocket.
The federal government says without the funding, they may also be forced to stop purchasing vaccines, antiviral pills, and those monoclonal antibody treatments that soon enough may not be available at all.
If people are not getting tested, they're not going to know if they're positive or not. They're going to spread it more. If people don't get the vaccines, they're going to end up in the hospital costing hundreds of thousands of dollars per visit.
It's still unclear what exactly the out-of-pocket cost might be for the COVID care that has previously been free. Along with all that uncertainty, healthcare providers are now being asked to take action of their own before it's too late.
We are actually being given the deadline that we have to hand in all the services that we've provided to the government's fund for payment. Otherwise, they're stating after a specific point next week, there's no more funding available.
And the House of Representatives already stripped COVID funding in its latest spending bill approved last week. Now all eyes are on the Senate to possibly pass something new with COVID funding in mind. Reporting in West Charlotte, Brianna Harper, WCNC, Charlotte.